If not, we'll move along in the agenda, and this time we'll do the business manager's report.
Copy of the treasurer's report for the period ending March 31st, 2021 for the general fund and cafeteria fund. Second.
Green Joe, but it's talk right up to it, Randy.
Can you hear me now?
Better.
There you go.
Okay. Try this again. We've received copies for the treasurer's report for the period ending March 31st, 2021 for the general fund and the cafeteria fund. We are submitting these to the board for your consideration of approval. Second.
Any questions? If none, all in favor say aye.
Aye.
Aye. Opposed? Ayes have it.
Okay, this one is much better. We do not have any budgetary transfers this evening. And we have received copies of the listing of invoices for the general fund and the cafeteria fund for the period ending April 13th, 2021. We are submitting these to the board for your consideration of approval and payment.
Second.
Questions, discussion? Randy, take a roll.
Yep. Mr. Albert.
Yes.
Dr. Beardy. Mr. Kunkel, Mr. Kunkel's not here this evening. Mrs. Marriott.
Yes.
Dr. Mathers.
Yes.
Mr. Ruffin.
Yes.
Mr. Schimmel.
Yes.
Mr. Snell.
Yes.
Mr. Ulmer.
Yes.
Business report of any kind, Randy?
Just a budget update. At the work session, we'll be looking at all the updates and the changes that have been made in the budget. I have received a few more pieces that will give us a clearer picture on where the budget is headed, and I'm hopeful that we will receive the IU contract by mid next week, so I can have that included in that budget, which will bring us to a better picture also. And then we'll continue on with the process and improve the proposed budget in May and make more changes. And the plan right now is to approve the final budget on June 8th. I will just reiterate what I have said during every board meeting. Our biggest concern with our current budget is our cyber charter schools. Enrollment still has not changed, so the information that was presented in November is where we are looking to have our cyber charter schools and our district cyber option come in at, which will be leaving us $833,000 short. I also want to make the board aware we have about 25 students from last year that have negative lunch accounts in over $50. The balance in total of these 25 students is just over $4,600 that they owe the district. We've been sending notices out almost weekly, and I have not had any of those parents contact me to make payment arrangements or to discuss any issues that may be prohibiting them from paying their overdue lunch accounts from last year. So we are going to be sending out notices that they will be going to collections. I just want to make the board aware of that. And that is all I have for the evening.
Thank you, Randy. Any questions for the business manager?
Yeah, Randy, I have one question. I've had a hard time hearing some of what you said about the past due collections on, I believe it was the cafeteria fund.
Yes.
What happened to the federal government saying that everybody's eligible for free lunches?
This is last year's debt.
That happened last year too.
No.
That only happened this year?
Correct.
There's no other questions. Thank you, Brandy. And of course, the superintendent's absence, no report. She said she would be sending out some updates to us in the next day or two via email. And with that, we'll move now to the agenda items. So we have the general agenda items. G1, we have the approval of the 2021-2022 school calendar for the first reading. Entertain a motion for that.
Second.
Questions or discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. G1, we have G2, we have an approval between the district and Central Susquehanna IU-16 for student information software for the 2021-22 school year. Based on our enrollment estimate is at $32,870. Do we have a motion?
Move to approve.
Do we have a second?
Second.
Questions or discussion? Not all in favor say aye.
Aye.
Opposed? Ayes have it. G3, approval to send approximately 38 MASD students to an extended school year program operated by Blast IU-17. Program runs 5 weeks, Monday through Thursday, 8:30 to 11:30, June 2021 to July 22, 2021. Approximate cost is $72,950. We have a motion. Discussion or questions?
How does this compare to last year? Do we have an increased need because of the pandemic, or is this about the same? Do you know?
I can tell you, I don't know the number of students, but last year it was virtual, so the cost was significantly less. It was around 47,000 last year, but I don't know the number of students. I didn't have that information.
Okay, I was just curious to know if that's the learning. Okay.
Okay, then, more questions or discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. We'll combine G4 and G5 if you don't mind. With your consent, approval to establish some activity accounts with bylaws for the MAHS Core Student Club and for the MAHS Custom Cut Woodstock. So to establish their accounts with bylaws. Do a motion.
Motion to approve.
Second.
Any questions?
Yeah, I have a question on the Montoursville Area High School custom cut wood shop. Do we have any explanation on what this is?
Well, they raised some funds, they had a church called fundraiser, they need a place to put their money. So that's why it's here for approval. They hold various fundraisers throughout the year.
Name custom cut, is that just a name they picked for the
Well, that's
club?
what the kids decide. Okay. Yep, the students picked that. There's some other names, but this one is good.
Any other questions? All in favor say aye.
Aye.
Opposed? Ayes have it. G6, approval of an agreement between the MASD and Indiana University of Pennsylvania.
Move to approve.
Do we have a second?
Second.
Any questions or discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. Before we do G7, some folks with some very good memory recall that we never did approve this. It's thought we might have. So the G7 should really be amended to read approval of the trip itself, striking out date change for because it's not a matter of a date change. And the line for the trip has previously been approved. That should not belong there. That was incorrect. So before we move to act on that anyway, Dan was going to give us a little bit of an update on that, well, just some of the potential pitfalls perhaps for that trip.
Should I go there? So this trip, it started as the Dominican Republic about three to 4 years ago. It switched to Costa Rica. That's probably part of the confusion of why it was not approved. But this trip, this particular one now, was supposed to occur last summer, and of course, because of COVID, it did not. And because of COVID continuing, it may not this year either. Several things have changed. Costa Rica just reopened their borders to travel and are just now accepting tourists. But with part of that, they're requiring a health insurance guarantee that anybody traveling to Costa Rica is required to guarantee $50,000 US dollars in health care monies if you are admitted for COVID. The trip package does not cover any of that. So I can't imagine Blue Cross Blue Shield or UPMC or Geisinger Health Plans guaranteeing Costa Rica $50,000. I know we're looking into that. The other thing is people can purchase through the National Institute of Health in Costa Rica this health insurance. Sounds like more of a fleecing than a health insurance policy. So that's one huge hurdle in getting there. I don't think the tour company can provide that insurance. I don't think our U.S. healthcare insurers can provide that insurance. So we have some issues there. They also are requiring a $2,000 U.S. dollar guarantee if you are quarantined during the trip. If you come down with COVID and have to quarantine. The tour group's COVID Care Promise does cover that. But there's an interesting line in there that they will only assist in connecting you with local healthcare providers. They are not going to go any further. They'll tell you where to go, but they're not going to help you once you get there. The final thing, news article came out today from Costa Rica. Their numbers have doubled during the past week, and they're looking to go back to the restrictions of closing their borders so that we may not even be able to get in when that's scheduled. Now, the reasonable person in me would have canceled this and not even asked for this approval because of what's going on, not just here in the U.S., but around the world with the pandemic. However, one person should not make the decision when there's these kind of amounts of money. This is the only company that we've run into this where it's not fully refundable if we cancel and if parents and kids can't go. So we have a total of 24 going on the trip. Some have backed out. There were a lot more than that. I don't have that total with me. But 24 remain committed throughout this. 2 of them would be out $165. There are 3 that will be out $1,000 and 19 that will be out $500 if they can't go. If the tour company cancels the trip or Costa Rica shuts their borders, that breaks down to the 165 remains the same, the 1,000 drops to 700, and the 500 drops to 350. So families would still be out. It's not fully refundable. It's my understanding, conversation today, that there may be a class action lawsuit to recoup some of that, but we know how class actions tend to work. You don't see that whole chunk of money back. So there are just a lot of hurdles, besides the possibilities of bringing some, who knows what strain will be out there then. If somebody gets stuck in a hospital, how long are they there? It could be, as we've seen, anywhere from no symptoms to a month plus in the hospital, or God forbid, even death. So that says approval. But with the amounts of money involved with the families, I didn't want to be the lone one making that decision. I didn't think that was
regular fare, so it comes to you, maybe instead of approval, I should say a decision on what to do with this one. So, if there are any questions, I can try to answer those.
Out of the 24, how many of those students are seniors this year?
I don't have that breakdown. The one thing, they are allowed to transfer this to a future trip. That's the other part of this. What's nice maybe for some of those seniors that are graduating, we've had a couple do this. They have 18 to 25-year-old tours, groups. They're separate from us. There's a tour guide and a tour group leader. That would all be done on their own time. Sounds like a great spring break trip when this is all settled. So a couple of students have taken advantage of that. I know, we haven't researched it fully. I know a few families will do that. Others just want, if this is canceled, to get out with the least damage possible. But I don't have a breakdown right now.
If there was the possibility of postponing it until next year.
That is a possibility as well, to postpone. There's also waiting to be approved the Panama trip for next year as well. So those would be discussions that we have to figure out after we decide.
Well, we'll entertain a motion then. We can have some additional discussion after the motion in a second. We have a motion? We have a second? We'll have a second on this. I'll second it. Discussion.
Yeah, I have a couple of questions. First one is, why was money put into this possibility of losing before the board approved such a trip?
I don't have an answer.
And the next thing I want to question is, I find it ironic that in our classrooms, our students need to wear masks all day. They need to social distance. Yet we're being asked to approve a trip to a country that the CDC has a level 4, very high level of COVID-19 in Costa Rica, and they recommend travelers should avoid all travel to Costa Rica. They also would need, before they come back, they also would need a negative COVID test to get into the United States. Like I said, I think it's ironic that we require our students to wear masks in a classroom for education and social distance. And then we're asked, and Dan, I understand that you don't want to be the school person, that's why you want to leave it up to the board, I understand that. But to be honest with you, for me, it's a no-brainer.
I have to agree with you, Ron. I just think it would be irresponsible of us to approve this trip. And I have the same question as to why did they put money out there before it was approved?
Again, I can't answer that.
Yeah.
It was 3-4 years ago. I thought it was. We all thought it was. And it wasn't, for whatever reason. It was a mistake. To answer the other question here, as I clarified, I'm not necessarily seeking approval for this. Costa Rica also has mask mandates in place. They're national mandates, unlike the United States. The U.S. is also level 4 under the CDC. A lot of the world is a level 4 under the CDC guidance. The U.S. State Department downgraded it to a level 3, where they asked to reconsider travel to Costa Rica. So they're at a level 3. That would jump up to a level 4 if they go back to closing their borders. So you have 2 different levels out there, the CDC and the State Department. It's a complicated game to play with travel. And again, I'm not necessarily looking for approval on this. Thank you.
Yeah, it's the funding for this. This is all student funded. There was no district dollars involved in this, correct?
Correct.
Now, can we vote? So if we're voting tonight whether to cancel the trip or not, or to change the date? Or I guess in effect, a vote to change the dates as opposed to keep the trip?
Well, it was never approved to begin with. That's an error in the agenda item. That's why had that date change struck out. Really, it's going to be as you see it. And the trip was not previously approved. It just was an error. The thought was it was, but indeed it was not. And so that's where we are now.
I guess my question is, can we vote, can we table the vote? Because if we vote no tonight, then do these families not get their money back? Whereas if in the next 2 weeks, if we want to play a game of chicken with the tour company, to wait them out to see if they'll cancel it?
I would say a no vote.
It's working.
I would say a no vote just throws it back to me and the group to reorganize and come back with a different plan if that's the case. This does not take any money out of their pockets yet. They have to actually cancel on their end, the parent does, or the child cancel on their end before the money would be lost. So we may end up playing, there's a 45 day window to have it knocked down. Is it the 350? Yeah. So there may be a little game of chicken, or we just push it back. But a no vote would throw it back to us to come up with a different plan.
Okay, so we're not deciding. I guess my fear is, what if someone gets COVID and needs to be quarantined down there in 2 weeks? Then do their parents need to fly down? I mean, the rest of the group would need to come back.
Yes, and the tour company would pay for a parent. They would arrange for the flight and pay for a guardian to come down and for the return. So that's part of their COVID care problem.
Jen, if you would like to withdraw the motion, we can then act on it and table it. If you think that's what might be the appropriate thing to do, just wait and see what Costa Rica is going to do. So the motioner is going to rescind her motion. I don't think my second on that is necessary. I think she can do the original motion.
Well, you have to consent.
Okay, I do consent. All right. So the motion has been withdrawn. Now we have the option to table this and wait and see how it plays out. If we'd like to do that, would you consider that?
Well, if it's withdrawn, you don't need to table it.
Okay. All right. It's
Consider table.
all right. It's
Back in Dan's corner with the group.
well, he can bring it to the board if he prefers to do that, of course. We could actively say no. Somebody wants to put forward a motion to forbid that trip, we can say no.
I have a couple of questions here. And the reason why a trip like this would need to be approved by the board is because of a school sanctioned trip would put liability on the school district for some types of actions, correct?
It would make it a school trip, yes, and there's a foreign trip policy as well.
But what I'm saying is we have to approve it in order for it to be a sanctioned school trip, which would make us liable should something happen and a parent, God forbid something happens and a parent wants to sue the district because it was a school sanctioned trip, that would be possible, correct?
Yeah, I'm not an expert on it, but I would imagine it would be limited liability.
Right. So if we do not approve this trip, those parents that have money already involved, it's up to them to take the trip if they want to save the money or, and not fight class action suit to get the money back, it would be up to the parents to take the trip on their own without it being school sanctioned, correct?
Yeah, what's happening with the 18, what's happening with the 18-year-olds that have pushed back and picked a different trip, they're going on their own. They're not part of the school we're going as.
Does our solicitor have anything that he might have knowledge on that at all? On what Ron was asking?
There is some increase in liability for school sanctioned trips. I know this board has been through a number of different iterations as to whether there should be school sanctioned foreign trips or not. The extent of liability depends upon a finding that the school district somehow did something wrong that caused an injury. There would also be workers' compensation coverage for employees who are on the trip. So there is some additional liability if the trip is a school sanctioned trip.
Any more discussion, board? Okay, then we'll work with this as being effectively tabled and move on then in the personnel section to some action items. P1 is for the approval of the retirement from a member of the support staff, Rosalind Winter, cafeteria head cook of 33 years of service, effective June 11, 21. We have a motion.
Motion to approve.
I don't know Ms. Winter, but congratulations on quite a lengthy career. Wish her the best in her retirement. Any questions? Okay, all in favor say aye.
Aye.
Opposed? Ayes have it. P2, approval of the following additions to the guest teacher list for 2020-2021. You see that list on our agenda.
Move to approve.
Second.
Any questions? All in favor say aye.
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 Opposed? Ayes have it. P3 is approval of the following substitute aid for, well, I don't think it says how many hours in there. Brandy, I think there's a missing digit in there. Is that fair to say?
No, it's 3 hours per day.
What's that? Oh, there it is, the table. Thank you. All right. So approval of that substitute aid through the end of the school year. Second?
Second.
Any questions?
Randy, was this budgeted for?
No.
Any other questions? Discussion?
Where is this paraprofessional located?
Ms.
So,
Reed?
I'll
Ms. Reed?
answer that one. So, this year at the Valley, as many of you know from lunches, we've had to have lunches within the classroom, and that requires every classroom to be covered by support staff. And what we found is that we're short-handed in that capacity. And so, Ms. Smith has been a substitute for us for years, and we spoke with Mrs. Basin about trying to do some of funding to help provide that extra hand to the remainder of the year. So we're happy.
Thank you.
Okay. Any other questions? If not, all in favor say aye.
Aye.
Opposed? Ayes have it. P4, approval of following addition to the coaching staff for the 21-22 school year. Sean Walker for girls basketball head coach. And you see the item there, the stipend of $3,900. We have a motion.
Move to approve. Second.
Questions, discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. Moving on to transportation, item T1, approval of promised land busing rates in the amount of $25.53.17 and $22.91.62 for March 21. Do we have a second?
Second.
Questions or discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. And lastly, the policy item. Item 1 for the revisions that we had discussed, approved last month. This will be the first and final reading, even though we've been acting on those revisions. Policy 006 for meetings and 903 for public participation at board meetings. I looked through them and it looks to me like we did get them nailed down to what we discussed that evening. So I think we're good to go. So with that,
Motion to approve?
Second.
questions or discussion? All in favor say aye. Aye. Opposed? Ayes have it. And that concludes our agenda items. And with that, we'll move on to other reports, and I'd ask our Vice President to walk us through the reports.
Okay, for PSBA, I do have a handout here. I had talked about this at our last month's meeting, and I apologize I didn't get it on the agenda, so we can't actually vote on it tonight, but I'll ask for it to go on the agenda for either a work session or the next meeting. And it's basically just the principles for governance and leadership that we had accepted these, committed to them 2 years ago, I believe, and we have to renew it every year. Or we can put it into our policies, into our board policies under the first section of our board policies. And then it doesn't have to be, quote, renewed every year. And it's just a reminder, they'll send us a nice poster that we can put up to remind us what our responsibilities are for governance and leadership in the school board, and we can read through that. So I'll bring that up for a vote. Does anybody have any thoughts on whether we want to put it in the policy or just affirm it every year?
Well, one thing about affirming it every year, Dottie, is it's a good reminder. If it's buried in the policy, you know what happens in policy. So
Okay.
having
Okay.
every year of affirmation is a good thing, I think.
That's a good thought. Okay. And then Brandy, you'll have to submit it. I think that's why we didn't get the poster last time. Maybe I submitted it and it's supposed to be the board secretary, so I'll remind you. Okay, thanks. So that's all I have for PSBA. Policy committee. Mr. Ruffing? No report. No report.
Dr. Beard. It's Dr. Beard.
Oh, it's Dr. Beery. Sorry, Dr. Beery. I keep forgetting that change. Are you then, Mr. Ruffin?
I have no report.
Okay, Mr. Schimmel, LCTC.
Well, just a little follow-up on the LCTC with the drafting and design program, that it's moving towards pretty firmly that it will be dropped. There's 5 students that were, if we could say, at risk. 3 are going to receive internships. 1 will pick up that curriculum at their home school. There's the 5th one, the status is to be determined, but they're working hard to make sure that need is taken care of. The intent is to, well, it doesn't really replace it. It's just actually starting a new medical administration program, if you will. And it would be a program that serves the need of the administrative, clerical side of the medical industry. It's not a healthcare worker in the sense of a nurse, nurse's aide, that kind of thing. It's for the office folks, if you will, to train them on those technologies. Someone could use this, an insurance agency, or anything like that. So they found that there's pretty significant interest in this potentially new program compared to the drafting and design that was sort of fading away. And additionally, the LCTC has the honor of having 19 students named to the National Technical Honor Society. That's the most they've ever had. So all in all, that was a successful year despite the COVID. So, and we meet this Thursday. I think probably that will solidify the drafting and design. I might find out more about the medical admin program. So that's all I have.
Mr. Conkle's not here for Memorial Garden.
I have an update.
You have the,
Yeah, I was working with Mr. Kunkel. There is going to be the cleanup May 1st at 9 a.m. for the Memorial Gardens, and editors will be there with mulch, so anyone that's available can bring their rake.
do we need to bring any equipment, shovels or rakes or anything? They have them?
No, bring a rake if you have one, yeah.
Mr. Almer, do you have anything for budget?
Process continues. We will have an update in 2 weeks.
Mr. Albert, building and grounds?
I have nothing.
Mr. Almer, anything from Montoursville Foundation?
Nothing to add at this time.
And did you have a report about extracurricular at all from Mr. Conkle? Andy? No? Okay. So that's it.
Okay, thank you, Mr. President. Yes. So this is like the business now, right? It's time for public comment. This is also a time when board members can have offered their thoughts about items too. So
Yeah, you know, spring's here, and we have to, I think as a board, we need to look a little bit. I mean, I'm sitting here in this mask, and I'm about ready to go nuts. So, it's the most I've had one on, you know, since it started. So, for me personally, and probably for the majority, I give these kids a lot of credit for doing what they've had to do to this point, but I think as warmer weather comes, we're definitely going to be challenged with the idea of these masks being mandated. I just want to offer out to the board, what are the options that we have as a board to try and do something to get these kids more out of these than in them? Is there anything that we could do as a board to show the importance of these kids being free here a little bit? I don't know, I kicked it around and tried to go back and forth, but at this time, I don't even hear anything. I don't know any statistics. Nothing's being shoved in my face about what's happening. So what is actually happening? What are the real things that are going on in these school districts? I mean, we're still open, and I'm thankful for that. And I don't want to do anything that's gonna, jeopardize that. But I'm just not seeing it. I know I go out in public and I walk around and almost every other place that I go to, there isn't anybody wearing a mask. It's a rarity. And, I've been in close contact with a lot of people that are not wearing a mask, and the ranges are far, 50, 60 mile. And, nobody's getting anything, nobody's doing anything. I'm just throwing it out there because I know that it's coming. I know there's going to be quite a few people that may not, want to stick it out here. I just want to know as a board what we're going to do what we can on our end. And I know the state's going to mandate whatever, but what are the facts? For me, I guess.
Well, Dan, we have our health and safety plan, and that is what we've committed to. We've approved that. That's our marching orders. That's with PDE. They have it, and we've attested that we will abide by our health and safety plan. To just arbitrarily deviate from that without changing the health and safety plan puts us at risk with PDE and taking action against us, which they could. We promised we would do it according to our plan, and if we say, never mind, we're not going to, that puts us at risk. So we don't want to be fighting legal battles and having lawyers go up against PDE lawyers on this issue. So
I totally understand that. Everybody understands that. But what do we do with this PDE, and getting them to understand also that these students, in this school district, there's going to be quite a few of them, I'm sure. And, I'll be honest with you, I wouldn't blame a kid for pulling his mask down below his nose. I wouldn't. I couldn't blame him. I mean, holy moly, I mean, how can you tolerate it? I'm not I'm not whining here, I'm just being realistic. And I appreciate what these kids have been able to go through, and our teachers and our administration. I mean, it's been a battle. I'm not saying about us being in jeopardy. I'm saying is that, eventually enough's gotta be enough. I mean, at what point? I mean, what's next? For me, I'm not hearing it. I'm not seeing it. I don't know. I mean, if you want to wear a mask, wear one. You can wear one 24/7. I don't care. But when it comes down to it, there's a lot of people out here that would like to have the freedom not to, and we don't have that option. And I've shared that before. And it's just, for me, I just, who's right? PDE, I mean, really? I mean, I don't know. I just think eventually this is gonna come to a head, and we gotta figure out something.
I have to say, I agree with you, Mr. Albert. I agree with you 100%. And I just want to say that I've seen, you bring up our safety plan, and we have to follow the safety plan. If we don't, we have a risk of getting slapped on the fingers by the state. Yet, it seems that in different areas of our district, that safety plan's getting overlooked. And I'm glad it has got overlooked, but I've seen sports with masks under their chin, and I've seen it on numerous occasions. And I don't hear any outcry on that. I don't hear anybody complaining about that, which I don't think they should complain about it. I think it's great. But if there's going to be an outcry that the students need to have masks when they're in the classroom, I've said it before, we need to be straight across the board with rules. And we're not straight across the board with rules. So, like I said, I agree with Mr. Alberts 100%.
I'm open, I'm not sure how they were doing the mask breaks. And like you said, as the weather gets warmer, will we be following all the protocols for how students have mask breaks? But unfortunately, like county numbers are much worse now than they were in August, September, and October. And there's clear data that some of these new variants are disproportionately affecting young people, and young people are getting sicker. So again, I'm open to the idea of mask breaks, but I think we have to tough out the rest of the school year. And the big question will be kind of how we do everything, come August. But I think the data would support that it would be very risky, especially indoors, to have students not wearing masks.
How many students do we currently have being at the high school that are out with COVID?
I'm not permitted to share that anymore, but order of superintendent.
I can share without sharing a name, and because I didn't get the information from the
I'm just looking for a number.
But we do have a student that has had myocarditis and pericarditis from asymptomatic COVID. And maybe it's one student, I don't know if other people do, but if that was your child, would you want that to happen?
I don't want
Wearing
anything
a
to happen.
mask
I don't want
is
anything to happen to
respectful
anybody.
other people.
I did, but I'm looking at the other side of it. I mean, I think there's more harm that's everybody can say that this doesn't bother anybody, but I'm sitting here and I can tell you it's bothering me.
Well,
Kudos to the kids for doing it, but I just, I'm not trying to be disrespectful in any kind of way. I truly am not, but I have heard nothing about the numbers in Lycoming County. Nothing from anybody.
I can pull it up on my phone, I track it every day. And I know like Coming College, we have our highest numbers now than we've ever had. And when they do the contact tracing, all the cases, were caught out in the public, in situations where people weren't wearing masks.
But
Where's the numbers in Montoursville area school district? When you say Lycoming County, you're including Williamsport, which Williamsport and Jersey Shore at the beginning of the pandemic, because of the nursing homes up there. Where's the numbers just for the school district?
But if people in the school district are socializing anywhere in Williamsport, especially without masks, the numbers in the surrounding areas directly affect our students' risk.
Well, one thing we know is our numbers are not high enough within our district to cause us to have to go to hybrid or remote. So we can be thankful for that much. So I suspect our numbers are not that high, not that bad. There are other school districts that have returned recently to hybrid or to remote. So we're not there, and we're going to hold out as long as we can to avoid that. Like we don't want to go remote. We know that. So
and you would account that because of the mask mandate?
I don't know why. I don't have that kind of wisdom. All I know is we are fortunate, and I'm thankful for it. I have 3 kids that wear masks. They don't like it. My wife wears a mask all day long at the hospital. She doesn't like it. But it's what we got to do. It's just what we got to do. I hate it too. Just what we got to do. It's not going to last forever. It won't. Because we know there are too many people in that camp that won't stand for it. We all have our crossover point where no more. We just got to hang in there for the rest of this school year.
I get that, but it's just going to evolve into something else.
Mr. Albert, may I point something out? I hate wearing masks as well. I would absolutely love to return to what it was last year. But we, at the high school, and I'm pretty sure at the middle school and elementary as well, I'm not sure mask breaks would even be possible because we no longer have those plexiglass things anymore. And we're all crammed into a room where it can easily spread like wildfire.
We don't know if that's possible. Again, if somebody wants to wear a mask, they can wear it. If they wear it and they wear it correctly, but they want to wear it and they want to protect themselves, I have no problem. That's not the issue. The issue with me is that you take somebody that doesn't want to wear one and they're just tired of it. And you're gonna see kids, especially as we press on here. And I just think I'm doing the right thing by bringing it up because it's gonna turn into something that we're gonna have to deal with. We're gonna have to. This isn't something that I'm bringing up just because I want to. It's something that I know is coming. And you're gonna have 80, 85, 90-degree days, more than likely, towards the end of the school year. And, it's either you're going to make sure that these kids are getting out and getting fresh air, quite regularly. We're going to have to do something because I can't imagine, especially our youth, our young ones out in the valley and here at Langer that are going to, it's going to be warmer than it was last fall.
We had very hot days in September where we had to compensate and give them, fresh air breaks, make sure that they had multiple water breaks. You make it work. And the kids survive. And I know that if I don't enjoy wearing it all the time either. But be okay in the end, you know, the big deal, it'll be over with.
And I think we're setting a good role model for our students on community health. I mean, there's rules that, you know, you can't, you have a speed limit. Well, heck, I want to go higher than that speed limit, but I can't because that's the law. Well, isn't it my right to do that? Well, no, it's not, because I could injure someone else. It's a community health issue. And I think we need, you know, the kids will take over what the parents and the teachers and what the adults model.
I have a question. Do we as a board feel that even into the month of June, our elementary students during recess are not going to be allowed to remove their masks when they're outside playing? I'm sorry, but I agree with Mr. Albert. I'm frustrated in the sense that if I understand the fear that is out there, but once you become vaccinated, you are to now have a barrier to prevent you from getting COVID. If our teachers are vaccinated, they now have a barrier to prevent them from getting COVID. We know from all the statistics and from our own observations for the past year that elementary students are not spreaders. We've closed buildings down because those students were infected at home, came into the school, didn't infect anybody at school, but were identified and shut the building down. But that's what we had to do. I just can't believe that we cannot at some point in this school year allow those elementary students during recess when they're outside in the fresh air to remove their masks. I fully understand if the parent does not want them to, but if there's permission, I can't believe that we're going to send students home if they remove their masks when they're outside and playing at recess.
I also want to bring up the point that our spring sports are not required to wear masks outside now. So we're going to let sports, athletes, go without wearing masks, yet we're going to have elementary students outside at recess masked up. It doesn't make any sense.
Yeah, if we allow these kids to be outside, I mean, you could do it by class. You could do it by class. I mean, the playground is quite large. You know, I mean, if there are parents that want their kids to have their mask on outside, I mean, I was just at a baseball game and there was a couple of students from, you know, the opposing team that were out in the outfield and they were playing with a mask on. I have no problem with that. That's perfectly up to the individual. But if people want their kids to be outside for recess without a mask on, they ought to be able to do that.
Well, and personally, Danny, I would support, I mean, the data is clear that outside, you know, if you can maintain some distance, is way less risky. So I don't know how the board feels, but I would be open to exploring that possibility.
Remember, to do that, it's in our health and safety plan. If the board wants to modify that element of the safety plan, we do that. That is our prerogative to change that, but we have to change that. We can't willy-nilly just do it. We have
Our
to.
health and safety plan needs to be updated. I do not believe it has been looked at since it was initial.
Probably not since what, last fall?
CDC guidelines. I realize our Pennsylvania Department of Health may not have adopted this, but CDC now says science shows that all we need to be is 3 feet apart.
That's only children, not adults. It's only elementary school.
And why is that, Dottie? Why is it only children? It's because the children are not spreaders.
Right.
Again, folks.
And so again, we get back into an argument of why, at least in the elementary, and even during the classroom time, can they not remove their mask?
Well, it's 3 feet with the mask on.
I'm sorry, but fear has just gripped our nation, and
It's biology, it's not, I mean,
unfortunately,
it's science,
I
we're
feel
school
this
district.
kind of responsibility that I can have a say and I could affect it. I spent my career as a respiratory therapist. I fully understand viruses and they're dangerous. I got my flu shot every
Hold the
year.
applause, please.
I would go to the emergency room and I would not have a mask on. I would treat patients with the flu virus. I had the vaccination. My job required me to have those patients cough and expectorate into a sputum cup. So these cloth masks that we have kids wear, I'm sorry, but they're not, they don't do anything against the virus. It's a show. The N95 mask is the only mask, and that has to be well fitted. Part of my role was that I had to do fit testing on my employees to ensure that they knew how to wear the mask and that it formed enough of a seal that they would not, in a relatively short period of time, feel the effects of exposure to a, in this case, anyway, I'm not going to get into the nuances of a fit test. Let me just say that I'm very confident in a mask that is an N95 and is properly fitted. But these cloth masks, like the one I'm wearing today, my wife made this one, and I wear it. But I'm vaccinated. I see no reason why I should need to wear it in this meeting, other than the fact that I'm doing it out of respect to some of my peers here who have expressed a desire not to be in the same room with those that are on masks.
Well, that goes, I understand what you're saying there. That's why I wear it when I do wear it, because I want to respect others. But we have to wear these because it's in our health and safety plan. We change that. We want to change that. I hear lobbying to change the health and safety plan. That's what we do. So if we want to do that, we need some proposals in changing that. That's what we do. That's part of our role. We just don't come up and complain about what we don't like. Let's change it. Let's make some proposals on how it should be changed. I mean, that's what we've got to do. So,
I believe Mrs. Basin had to sign an attestation that her license, her certificate as her principal is on the line. If you don't follow it,
yes.
she signed.
And if we make a change to it that doesn't meet what PD and DOH approves, then we put the superintendent at risk. So we've got to be very cautious about how we do this. It's just that simple.
One more comment.
We're boxed in.
The CDC also has now said that there is no transmission through contact. This is a respiratory virus. So again, we have spent tens if not hundreds of thousands of dollars on equipment and manpower to wipe down these surfaces. It's probably gone a long way to preventing any kind of a common cold transmission, but what effect is that now going to have, especially if we look at our next budget year? Are we going to have to continue to do those same practices? That is in our health and safety plan and needs to be addressed.
Yes, it does. Yes, it does. So that is part of what we do in concert with the administration. So we've got the conversation started. We have to keep that going, and the board, that's our role. So I hear you. Don't disagree at all.
Dave, I want to add one more thing about these masks. Those paper masks like you wear do absolutely nothing. And when we're sitting here in a meeting going on, well, over an hour, that mask you've been breathing through is damp, it's moist, and it is doing nothing. If you would have COVID, you might as well have that mask off. And I want to add that I was in the hospital for a visit this week, and you know the hospital people don't even wear the N95 mask. That's how much of a joke it is that they're wearing those paper masks all day that do absolutely nothing. And we're requiring our students to wear masks all day, and I agree with Dale and Mr. Albert there that it should be a choice. If they want to wear them, fine. Go that against them, but if they don't want to wear them, they shouldn't have.
Ron, as to this paper mask, actually, I wear it because I have read the University of North Carolina and EPA rigorous study on the effectiveness of the various types of materials and masks. Generally speaking, the effectiveness is destroyed when it's not against your face, when this area here is open, when under the chin is open, when it drops below the nose. That is when the effectiveness of about any mask is destroyed. This is effective. It's probably, from what I read, probably around 26 to 30% effective. Look, I don't disagree. And then the cloth ones, depending on the tightness of the weave, that'll dictate how effective they are. So, again, that study was rigorous, covered all kinds of masks.
And the longer you wear it, the less effective that mask is.
No, because the pores don't change in size. The pores, the filtration doesn't change. It's how much it leaks out around the mask. That's the most important factor, is how does it leak around the perimeter of the mask. That's where it matters most. So, look, we're going to beat this horse all evening. I thought we'd get out of here early. But look, we have work to do. We all agree. We think there's room to change this policy, or the health and safety policy, but we can't put the superintendent or the district at risk. So we've got to keep that in mind. Anything we do, DOH or PD is going to look at it, and if they don't like it, they're going to have words with us, and we could be spending money on lawyers fighting it. So it is not that easy to change that. We know that. So, okay, are we good?
And I remember one of those meetings, there were a number of high school students who were concerned when we were going back full time, and anyone with an elderly relative living at home. Now, I don't know how, but I would almost be afraid there would be a flock to cyber charter. I think we'd have to look at the dollars of the risk, but I think there's a lot of students, especially if there's a grandparent in the home, that would feel less secure, and that could potentially have implications for the district.
You're probably right. Okay, we have work to do. We know that. So with that, we'll move now to the public side of this. We've talked about this a lot. I think we're ready for a motion to adjourn.
Motion to adjourn?
We have a second?
Second.
All in favor, say aye.
Aye.
Opposed? Ayes have it.